Welcome to the Transforming Healthcare Coaching Podcast, where we're all about helping healthcare professionals like you create positive change at work, at home, and everywhere in between. Welcome to the Transforming Healthcare Coaching Podcast. And this month, we are super excited to be celebrating Emergency Nursing Week and also Physician Associate Week. I'm super excited to be able to talk with Klaus today, who is a physician associate in emergency medicine. So it's like a 2-for-1.
I know this is a perfect one because obviously I work with many PAs. I also work with emergency nurses. So this is a perfect episode, I think, to honor both professions.
So I think the other thing too that we're sort of riding the high of is last month in September with the Emmys, the Pitt really was able to highlight and feature so many aspects about emergency medicine and bring back the excitement for emergency medicine in general and all the different people that work in emergency medicine. And so I guess curious, and you probably get this question all the time, what's one thing that you would like to say to your colleagues who practice in the department for this month?
One thing I want to mention is I still haven't seen the Pitt.
Oh, that's okay.
I hear such great things. It's actually on my to-do list to go listen to. But what I would say to the colleagues that I have in my department is first off, I think would be to be proud of the work that you do. I think it's so easy to forget why we got into medicine in the field that is so fast-paced, dealing with critical illness, oftentimes being shouted at, that are beyond your control, a lot of moral injury as a result of practicing in this field, oftentimes feeling like you may have limited resources and work in a community setting. So having that as its own unique challenges with working with constant different staff. And I would encourage my colleagues just to remember the work that you do is so important and that you have such a breadth of knowledge and skills that are amazing and powerful and unique. You are able to see a patient come through the ambulance bay or walk in and be able to just look at them oftentimes and say, sick or not sick, and make quick decisions to start their workup, figure out what's going on, or start administering treatment before you have results back. I think it's just powerful. And it is a scope of medicine that I think doesn't get the attention that it needs. I can imagine where my consultants come in, they're like, oh, you're calling me about this? But I think what they don't see is the times that we're making these decisions without them as well, because we are forced to in critical times.
Really like that. The reality is I hope everyone can to wear their crown a little bit higher because we are the front door 24/7, 365. The many times that I've had to go be a patient, either for myself or my daughter or my loved one, through the emergency department, I'm always amazed by the understanding, speed. There are issues in terms of sometimes you have to wait. And at the same time, like, yay, so I get to wait. I'm not actually one of the critically ill patients. So we are all going to use the emergency department at some point in our life or know someone that has. And to be the safety net 24/7, 365, I hope that everyone who is working a shift can recognize that they should be really proud of the work they do, whether it's small single coverage emergency department, urgent care out in the rural communities, all the way to the big academic center, level 1 trauma centers. They're different and they're both really vital for everyone's care.
Yeah. And I like that you mentioned urgent care. I think that they deserve a shout out too. I think they're oftentimes unrecognized in a lot of the care and oftentimes are our bridge between primary care, emergency care, and sometimes are helping to alleviate the burden of the emergency room. And I think they deserve an applause too, because you're also practicing medicine with limited resources and doing your best for the patients to hopefully try and save them an emergency bill, but also to get them the quick follow-up with either with a specialist or with their primary care if it's something that needs that attention.
Yeah. I know there's so much negativity and complaint sometimes in terms of how the system works and how the system runs. And yet when you take a step back, like you and I are doing right now, I mean, everything should be celebrated. We're really glad to have the entire gamut of care and NPs, PAs, physicians, nurses, techs, EMTs, volunteers, students. I mean, that's who we hang out with. And actually, also police and fire. We hang out with a whole bunch of people in the emergency medicine world. And I think we're lucky that we get to do that. It's a much more pragmatic way of seeing the world. And we don't really care who or where you come from. You can be an immigrant, you can be undocumented, you can be a wealthy VIP CEO, you could be the mom of your friend's soccer team's coach. You could be anyone in the community, and we're going to take care of you. So I think that's the most magical thing about the entire continuum of care for emergency medicine.
Yeah, and that those connections that are very important to build, and it's so easy to get caught up in oftentimes this environment that can seem very negative. The workplace culture in emergency medicine can sometimes be very negative, where we're complaining about many different things, and so it's important to remember that fact that you just said. There's so many different connections that we can build with different colleagues, maybe not direct colleagues, as you mentioned, police, fire, EMS, and to be proud of the work in the system that we've created for ourselves. And granted, we are oftentimes probably very upset about the big overall system, but all we can change is ourselves in that moment, and remembering that we need to stay well ourselves in the process.
And so I'm curious, you are still clinically practicing physician associate, plus you are a preceptor and you teach and you're in the education realm for new students. And then you're also a coach for healthcare professionals and leaders. And so I'm curious how your frontline experience being a physician associate and in emergency medicine has shaped your perspective on what healthcare leadership can look like.
That's a great question. I think it just comes back to everything you just mentioned. I really needed to take a step back during COVID and see things from many different perspectives, from a patient perspective, and remembering that I was becoming very negative myself about the system and how things were happening. And it was a shared energy among all my colleagues. And many of my colleagues left the field entirely as a result. And that's what led me to my own coaching journey, was saying, I know I need something different. And as a result, I realized we all need something different and how to do so in a way that says, I'm not controlling that aspect, but I'm offering people the opportunity to make those changes in their lives and within the system. And so that's kind of prompted that journey. As a result of that stepping back approach that we do as coaches and doing the work for myself to say, I'm not well, I need to get well. How do I do so for myself? I really realized that a lot of people can benefit from this outside in approach. And I think that is probably what led me to work with a lot of healthcare leaders. Same thing with working with students, is just having broad perspective. For a while, I never really resonated with the leadership role. I had never felt like I was a true leader. But when I started to realize that I am a leader within my own life as well as in my profession, I have a voice to make positive changes. I think that's what offered me the opportunity to say healthcare leaders could also benefit from this perspective.
Like that. Both of us have really evolved from seeing ourselves as just clinicians to understanding our broader impact in all the different roles and responsibilities. Like you said, being a leader of your own life. And I'm curious, how did that shift happen? Because I know there's a lot of people listening who may not have any position or a title, or they're just wondering and sort of curious about what is this coaching thing that everyone keeps talking about. A little bit like, you don't need to get in my business kind of attitude. I'm curious what the shift looked like and how did it sort of evolve?
Well, it took time. I'll start with that. And because it's so easy to be like pushing it to the side, saying, oh, it's the system that needs to change. It's my leaders that need to change. It's not me. I'm not the problem. It's so easy to say it's somebody else or something else. And I think I was caught up in that for a while myself. With the continued work that I was saying, I'm not well, I need to change. And I started to make changes in my own life, both personally and professionally, and really remembered why I stepped into medicine, I think was a very big thing. And I think we often forget that as healthcare professionals. So I took that approach and remembered who I am authentically. I think that was so important. And as a result of that work and figuring that out, I started to have an appreciation of other roles and the greater system, and then the challenges that they have that are oftentimes not as transparent. So I think for a healthcare leader who's listening to this, is that transparency is so important of understanding what your challenges are, because a lot of healthcare leaders feel like they need to stand up straight and say, I got this all. I have an answer for everything, when sometimes not having the answer is okay, and just saying, and even offering a question to your team and saying, I don't know what to do for this next step. I would love to hear some other insights, because more heads in a challenge are oftentimes lead to a greater solution and quicker. There's nothing wrong with it. It doesn't say you're a bad leader. I think if anything, it says you're a great leader. You're offering my insights and that I can make those positive changes. And I think as a healthcare leader too, or even just as a healthcare professional, oftentimes we think we're just our role. I'm just a nurse. I'm just a PA. I'm just a physician. But we're more than that. We are the work environments that we're in. We are the professional experiencing the day-to-day life and are noticing the changes that need to happen. And so our voices are so important. And so I think that's what, over time, that work for myself, still practicing clinically full time, seeing the challenges, and just being able to say, I have a voice and I can do so in a professional manner. And I think that's where that leadership unleashed is saying, wow, I am a leader. I have a voice. How do I make it heard in a way that's professional? And I don't need to have a leadership title to say that I'm a leader. When I started to embody this whole leadership, I'm like, oh my gosh, everybody's a leader. The nurse that is managing my patient, they are a leader. I hear them. They're answering all the questions for my patient. And if they don't know, they come and they ask me. And that's what makes a leader, is knowing what they know and knowing what they don't know, and then getting the answers in a way that is collaborating with the team for the best possible patient care.
Well, so many good nuggets in there in terms of the fact that we all have the opportunity to be the leader that the system, the patients, our teams need us to be. And really, the leaders with the titles are just meant to co-create with you the environment that it's okay for everyone to have a healthy discourse and solution testing. Because I think the reality is we always complain about solutions not being frontline generated. Well, I guess the question is, well, did you suggest your idea? I mean, and I think the other hard thing is a lot of times people think, well, I suggested and no one took me up on it. Well, there's also 50 other people and there are 50 other great ideas. Everyone's turn will come. If anyone's been through one of those brainstorming sessions, like all those post-it notes of ideas, at some point, the right idea will happen the right time in the right way. And it's still really important that you suggest the things that need to happen, because I get to see some of these projects come to life now, like a year later, and people have been suggesting something for a little while, and we try some pilots, but then everyone gets their turn in the sun. So I think that's the one thing I probably would want to say to people is that you'll get your chance. Like one of these ideas will hit and it's all good.
I think a lot of the healthcare professionals come to us for a lot of those reasons. They want to make these changes, and they do. They say them to their teams, because what healthcare leaders I don't think understand too is that most of their employees want to be there. They're proud of the organization that they work for. They're wearing their organization on their scrubs or on their jackets, and they're showing up every day. And I think the problem with a lot of what we do as healthcare professionals about sharing our insights is we don't know how to, as you just mentioned. And then if it gets rejected or it doesn't happen immediately, we feel defeated. And oftentimes it's like, well, if this organization is not going to listen, I'm going to look elsewhere. And I think that's a big struggle that we're seeing in medicine, is that, and why we're struggling with retention, is people are constantly looking for their voices to be heard or to see changes that they recommend. And if they don't see it within their organization, they look elsewhere. Or some of them consider leaving the field completely. And I think that's when a lot of people come to us, is thinking, I don't know what to do. Or I'm considering this and I need some better insights. And I think you offered some great advice, was keep plugging at it. We know that things in healthcare moves at a snail's pace, unfortunately. And I think that actually goes with a lot of big organizations, even outside of healthcare. But if you can do so in a very professional way and stay at it, if you truly believe at it, you can make those changes.
And I think that's the reason why we've seen coaching different professions and different people in the leadership team, that it is a dyadic experience in terms of being heard, setting people up to be heard, and then negotiating and figuring out a solution forward. And so when we think about what coaching has taught us, every healthcare role brings unique strengths to leadership, like you've mentioned. So, what strengths does emergency medicine focused professionals bring that we really haven't fully celebrated or recognized?
I think there are so many strengths that those in emergency medicine experience. And I think the hard part is we maybe don't voice it enough, or we don't say it enough in a correct professional way that gets heard by the people that need to hear it, because we're so busy with just working and varied shifts. Like we may be coming off an overnight and it's like, I can't send an email at 7 in the morning about this or call somebody. I need to prioritize my sleep, or I have a shift next day and then it all of a sudden gets procrastinated and pushed aside. So I think that's a big struggle. But from emergency medicine, like we work with all the consultants, number one. So we know everybody. And we know everybody's style too. And I think there is strength in knowing that when we're talking to the CMO or we're talking to somebody in the trustee or the board who's looking for insights about how we can improve. I think that's a really hidden insight, is that those who practice in emergency medicine just have such a great perspective of the way things are seen. Obviously, we don't see other things that are happening on the floors, but we are that bridge to the floors and we bridge the connections. And I think we have some greater awareness that really can be powerful in making changes that are necessary for an organization if we can just get our voices heard.
Yeah, I think also you sort of encapsulated as I was listening to you talk was the fact that emergency medicine encapsulates the both and or the yes and primarily because it's all good. Anyone's welcome here. We understand a lot of people's different perspectives and we're willing to collaborate. I think that's the most unique thing about emergency medicine in general. All the people who work in the department can find a solution to be able to be that bridge from pre-hospital care, the doorway to the hospital and the healthcare system for many people, and then onward and inward to get you connected to the right specialist to be able to get you the right care that you need at the right time. And then also knowing when to turf, when to say, what, this is really subspecialized. I'm going to get you in contact with the right subspecialist and to basically say, like, I'm the mega coordinator to be able to help you find your right healthcare journey in this time and day.
Yeah, it's a lot of fun. I mean, from somebody like me who I guess I consider myself an extrovert, I love working with other people. I love working with patients. I enjoy a very collaborative environment. And I think for the healthcare leaders here listening, invite your emergency medicine, those who may not hold a true leadership position, but are leaders within their own environments, for insights if you're looking to make some changes within the greater scope of your organization.
Next question I want to turn a little bit towards the future in terms of what excites you the most about the next generation of emergency nursing and physician assistant healthcare professionals, the students, the different fresh perspectives they're bringing, keeping us all young. Curious what excites you the most about working with all of the different learners in your department.
Well, there's so many things, but there are a lot of things evolving, and I think in the emergency medicine field, I think one of the things that we've talked about in a previous episode was about how COVID, though very destructive and unfortunate, shed light on healthcare professionals, burnout, and challenges, saying something needs to be different. What I'm seeing a lot now is in even just PA education is wellness and well-being curriculum being built in. So I think that's incredibly powerful. And that generation who's experiencing that is bringing that into the actual healthcare workforce and saying, we need an environment that supports ourselves through these challenges, because for many of us, we didn't get that. You probably could speak to this. And it's still happening today with residency. They're working 100 hours a week, 24-hour shifts, no breaks, lack of sleep. And we know that that's not healthy. It opens the opportunity for errors. It can be catastrophic to your personal life with your relationships, even just your physical health. And so I think they're challenging the system in a way that says we need changes to keep ourselves well. So I'm excited to see how more voices in this new generations can spark some changes that I think are so needed for many of us to remember that we are also human beings. We can also be patients, as you mentioned, Lily. And how can we prevent that? I'm a big believer in prevention. And so, how can we prevent that by staying true to the foundations of health and wellness?
I really am looking forward to the ideas. I think that's what I love about every generation that comes forth is that there's new ideas and new expectations. I think what I always try to tell at least my mentees is ask for it. I get the fact that it sort of will be a little strange in terms of the contract negotiations because they just think, well, take it or leave it. It's this is the way the contract's written. It's like, well, can we have a conversation about how we can modify some of the terms? A lot of times there'll continue to be pushback because there's a lot of systemic bullying that occurs in different HR practices. But there's also ones that are very healthy where they're like, let's have a conversation about it. If we frame it as that, we can figure out maybe how many hours, what the benefits are, what's more important. A lot of younger generations are recognizing the balance and the ability to balance both the time along with those shifts and the expectations, like what can be considered bonus work and what's considered minimum work is a more healthy standard so that when things do get tough and might have to pare back a little bit for health reasons, it's not a shock or a scare from both the employer perspective and the schedule maker. Because right now we're all just pretending everything's fine, running really lean. So that if someone has to go out for 6 months for cancer treatment, the entire group literally delaminates. And so I think we definitely have a different way forward if we think about how we have set up this system for success. I'm excited that the new generation wants to do something different.
Yeah. And I think I'd love to offer an invitation to the physician associate, to the emergency nurse, or the emergency healthcare leader who's listening to this episode and is resonating to this content and it says, oh, I don't want to be enveloped in this negative environment and culture that I'm in. And I want those positive changes that you're hearing or that we're saying here. And you want to make changes to your life so that you can prevent illness and a lot of the challenges that result with working in our environment, to book a call with us because I'd love to help you figure out what your next step is to being well. So I'll put that in the description as well.
So I guess to come to a close, as we celebrate these important weeks for celebrating physician associates and also celebrating emergency medicine nursing, what would you like people to understand about the collaborative nature for the great work that we do in the department?
I think I'd like you to remember that we are a team. It is so easy to be segregated and say, oh, I'm just a PA, they're just a nurse. We have different supervisors, we have different training. What we can do oftentimes is greater than we can do apart. I think is a big thing that I'd like to leave everybody with today. And that you can be supportive as a PA to your nursing team by helping them when you see they're struggling, as the nurses oftentimes do for us when we are running around also managing like them multiple different patients. We can support each other by helping each other with tasks that we both can do, obviously act within your scope of practice. But I oftentimes will hear patients yelling out, like, I need to use the bathroom, I need help. And oftentimes it's just a question that needs to be answered and they're screaming on the top of their lungs. We all know that feeling of being in the ER when there's people screaming and it's like, oh, I just wanted water. We could help with that or help somebody to the bathroom. These are things that we all can do. So remembering that we are a team in this collaborative environment.
And so I just want to say thank you to all of our emergency nurses and physician associates working in the emergency department this year. And we also want to let you that we have a community for people who are interested, a private community for interested in becoming more well and finding their people who want to do something different and be something different. And that's our Med Thrive group coaching community. It's a private community, so no more Facebook trolling and no more strange bullying that happens in some of those public forums. This is a private place that's vetted just for healthcare professionals. So check it out. We'll put a link below in our YouTube comments. Thanks so much, Klaus, for coming on and talking and celebrating Physician Associates Week and Emergency Nursing Week.
Thank you for celebrating us.
Bye, everybody. Thanks so much for listening. If you found value in today's episode, please subscribe and share with a colleague who would benefit. Together, we can transform healthcare one person at a time. Find us anywhere you find your podcasts. Ready to take your healthcare leadership journey to the next level? Book a discovery call free at transforminghealthcarecoaching.com to explore our personalized coaching packages designed specifically for healthcare professionals like you.